Hello, my name is Katie Nation, and I'm with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. The purpose of today's webinar is to help you understand the roles and responsibilities of the roles in MACPro's Health Home State Plan Amendment review and approval process. Additionally, by the end of this presentation, you will understand the next steps for getting ready to work on health home spas in MACPro. The call is on presentation mode to prevent background noises. There will be an opportunity to ask questions at the end of the presentation. CMS and training personnel are here to assist with any questions you may have at that time. If you have a question during the session, please feel free to send it via chat to the attendee named Ask Me a Question. The host chat box will not be monitored during the training. Also, please note that we are recording this session for future viewing, and the slides presented today were provided via email. The slides and the recording will be posted on Medicaid.gov in the future. Our agenda for today includes a brief synopsis of the MMDL to MACPro conversion process, a refresher on the CMS MACPro Health Home SPA roles available, an overview of reviewing a Health Home SPA submission package, and a step-by-step in the system demonstration. The webinar will end with some information about how to contact the MACPro Help Desk to obtain technical assistance, next steps on getting started in MACPro, and a final opportunity to ask questions. Health home spas previously approved in the Medicaid Model Data Lab, or MMDL, will be converted into MACPro. The data in MMDL from approved health home spas will be copied into the MACPro Health Homes template for states to use as the basis for future amendments. States will find the MACPro screens pre-populated with the currently approved information, except where the MMDL and MACPro templates differ. Additionally, the official and complete copy of all health home spas approved in MMDL may be viewed in MACPro as PDFs. Health home spas currently being processed in MMDL will be completed in MMDL. And once the MACPro Health Homes application is operational, CMS will announce a date by which the last submissions can be made in MMDL. Finally, when subsequent spas are submitted and approved in MACPro, they become the official record of the Health Homes program. Now we will briefly review the different health home spa user roles within MACPro. This information will be familiar to you if you attended one of the MACPro roles trainings a few weeks ago. A number of distinct roles have been established for CMS within MACPro. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPro differ from those that are used in CMS's other web-based systems, and in some applications, this is the first time that there are roles. Let's discuss the roles and recommendations for who should hold each type of role. This page shows the CMS MACPro user roles that will be covered in our in-system demonstration today. These are the 4 most central roles within the CMS approval workflows, including the CMS point of contact, the submission review team, CMS senior management, and CMS package approver. The CMS point of contact, or CPOC, is the person responsible for the review process and ongoing communication with the state regarding a submission. The Submission Review Team, or SRT, is the role for individuals identified to review reviewable units within a specific submission. Reviewable units are essentially sections of a submission package, such as health home payment methodologies or health home service providers. Future trainings will go into reviewable units in further detail. The person with the CMS senior management role reviews the submission and the approval, disapproval recommendation. The CMS package approver approves the submission packages. This slide shows the remaining CMS user roles for Health Home SPA outside of the approval workflow. Instructions related to completing actions using these roles will be forthcoming. Now, let's look at how these roles operate in the review process. Here is the full CMS SPA approval workflow. Right now, this may be a lot to take in, so let's break the approval process into two parts and look closer. This is the first half of the approval process. First, the state submits the official SPA submission package to CMS. Then, the CMS point of contact, or CPOC, receives the submission package. The CPOC selects submission review team, or SRT members, for each reviewable unit or section of the SPA submission package and sets a milestone date for their completion of their assessment within the review tool. The milestone date is essentially an internal due date to ensure the review stays within the 90-day clock. If during review there are some quick questions and potential quick revisions that need to be done by the state, a clarification may be done returning the package to the state. A clarification is what you may know as an unlock in MMDL. We will go into these steps in detail in a few slides. Once the review of the submission is complete, the CPOC provides a recommended disposition within MACPro. The CPOC may recommend a request for additional information, or RAI, based on the review of the package. This will return the package to the state with specific questions and stop the 90-day clock. We will go into this process in detail in a few slides. The CPOC may also recommend disapproval, and this alters the workflow. We will review the disapproval workflow as well. If the CPOC recommends approval, he or she will then draft the approval notice and select senior management roles to review the package. Senior management then reviews the package disposition recommendation and has the option to request a meeting or disagree with the recommendation. After recommending approval, the CPOC sends the submission package on to other CMS members. This begins the second half of the approval process. Senior management then reviews the package disposition, and we will assume that senior management agrees with the recommended approval. In some instances, the CPOC may bypass outstanding senior management responses in order to keep within the 90-day clock. Next, the package approver receives the package. He or she has the option to request a meeting. The package approver does not have the option in MACPro to disagree with the recommended approval. Once the package approver agrees with the approval, the CPOC receives the package, uploads the PDF approval letter, and returns the package to the state point of contact. The state point of contact receives the package and acknowledges receipt. Finally, the CPOC closes the package in MACPro. Next, we will review the CMS review process in more detail within the MACPro system. Today's system demonstration will cover the steps that we just reviewed within the CMS workflow. Additionally, we will discuss how to initiate a clarification request, known as an unlock in MMDL, and RAI, or request additional information. Now let's move into the MACPro training environment to take a look at this process. We will get started by logging into MACPro as a CMS point of contact. We are working in the training environment today, and therefore the information that you see during this training is arbitrary, only being used for training purposes. Additionally, we are going to be using the state of Iowa, but this is not a reflection of Iowa or their health home information in any way. When you first log into MACPro, you are taken to your news page. This page operates similarly to a social media platform. You can write a post for your team, send a message to an individual, send a task to an individual, or recognize someone by providing them kudos from the text box located at the top of the page. Additionally, activities related to packages you are working with or are following are listed for your reference. We will assume that the state point of contact just submitted an official submission package to CMS. CMS points of contact associated with that state receive an email notification letting them know that there is a new submission and a task in their to-do list. We are now logged in as a CMS point of contact in the region for Iowa to take a look at this submission. The upper toolbar is important for general navigation within MACPro, and each tab serves a different purpose. The Actions tab is for initiating new actions. There is also the News tab, which is a location that provides general status updates on packages and can be used for informal communication about packages between different MACPro users. Then there is the Tasks tab, which is where specific actions as part of the workflow will populate for you to work on. Tasks are activities that are needed to keep the package moving through the workflow, such as reviewing a submission package. Then you'll notice there is a Records tab. This is where you can go to reference submission packages that are complete or in progress. Finally, there is the Reports tab, which can be used for tracking different activities within MACPro. We will explore each tab in further detail throughout this training. I will also point out that the name in the upper right, labeled as Help Desk CMS Point of Contact Iowa, is listed in the first name, last name format. In the training environment, Help Desk is the first name, and CMS POC Iowa is the last name. This will display your first and last name as you navigate through MACPro. In order to start on our task, let's select Tasks on the upper toolbar. As I just mentioned, the Tasks tab includes tasks that I can complete as a CMS point of contact for Iowa. You may notice that there are some quality measure actions included. You will only be able to access these links if you also have access to the specific quality measures authority in addition to Health Homes. For Health Home SPA, the first step that the CMS point of contact takes with a submission package is to assign the reviewable units to CMS review team users. Please note that the links to these submission packages are identified by the package ID and by the SPA ID. First is the package ID, which consists of the two-letter state abbreviation, the year, the authority, in this case, MH for Medicaid Health Homes, an automatic number assignment, and the letter O for official or D for draft. We will select Assign Reviewable Units to SRTs for the package ending in 741A. Before we assign submission review team members, I want to pause and point out that the state can submit two different types of submission packages to CMS. If we click on the first reviewable unit link, the submission summary, and then click the plus/minus button to expand the submission type field. You will notice that this is an official submission package. An official submission package is used when the state is prepared to submit to CMS. This starts the 90-day clock. CMS may review, approve, implement RAI, or clarification. The state may allow CMS to view the information in a submission package prior to submission informally by using the Allow CMS to View functionality. This may be used, for example, if the state has a specific question while they are working on the package and want to run it by CMS. The second option for a state to submit is a draft submission package. The state may allow CMS to view a draft submission package when significant feedback is required prior to starting the 90-day policy clock. It is suggested to states to initially submit complex programs or new health home models and new targeted amendments as draft submission packages. CMS may review but cannot approve, disapprove, or send it in to request additional information. CMS will return the submission package to the state with feedback. If the state chooses to edit the submission package, the state must resubmit the draft to CMS off the policy clock. Alternatively, if the state chooses not to edit the draft package, it can be closed, converted to an official package, and submitted to CMS. The CMS point of contact can then assign one or more submission review team members to each reviewable unit. Let's return to the summary page by selecting All Reviewable Units located under the audit information near the top of the page. Each section of a submission package is known as a reviewable unit. There are submission reviewable units with every submission package. Then there will be program-specific reviewable units called Health Homes Reviewable Units. The Health Homes Reviewable Units generally align with the Health Home SPA sections in the MMDL. A new Health Homes program will include all reviewable units, but an amendment to a Health Homes program may amend one or more Health Homes Reviewable Units within a submission package. You may begin typing in the field box under SRT users, and a drop-down list of SRTs will appear. You can search an SRT user by last name, first name, or username. We will search for the first name, Help Desk, and choose Help Desk CMS SRT Iowa. Please note that in this training example, Help Desk is the user's first name and CMS SRT Iowa is the user's last name. Although the CPOC's name does not appear in this text box, he or she is automatically assigned to each reviewable unit as part of the review team. The CMS point of contact will repeat this process for each submission form reviewable unit and Health Home SPA reviewable unit. If a submission review team user needs to be removed from a reviewable unit, you may do so by clicking the X next to his or her name. The CPOC is able to assign multiple SRT members to each reviewable unit. This is up to the discretion of the CMS point of contact. An important thing to know is that the CPOC will automatically be assigned to each reviewable unit. So there isn't a need to assign a submission review team user to each reviewable unit. Only one review team member needs to review a reviewable unit in order for it to be considered complete. This may take a couple seconds here as we fill out the SRT users. I will pause and let you know that if you do experience any issues as you move through the Health Home SPA process, the help desk is here to help with any issues or questions that you might have. We will review the help desk information later on in this presentation. The CPAC will then set the milestone date. The milestone date is an internal due date for this task that helps keep the review within the 90-day clock. The review team members will receive a 3-day warning notification as the milestone date approaches. If the milestone date passes, the submission review team users will get alerted. The task will remain in the SRT's task list, but it will be noted that it is overdue. In addition, the CPAC does have the option to edit the milestone date. If you click in the box, a calendar will appear. For this demonstration, we will choose April 14th, 2016. There is a text box labeled Instructions. This is where the CPAC can provide instructions for the submission review team members. Consider this the Post-it note attached to the package you would be placing on your colleague's desk. We will type, "Please review the reviewable units as assigned," as instructions for the SRT members. After reviewable units have been assigned to SRT users, the milestone date has been set, and optional instructions have been entered. The CMS point of contact will then select the green button labeled Assign Reviewable Units. A message will appear asking if the user wants to assign reviewable units, and we will select the green button labeled Yes. Now, let's return to the PowerPoint to review what we have done thus far as the CMS point of contact. This slide includes the information about what we just reviewed in the system. This is for your future reference. Let's take a moment to review the differences between the two submission types. When official submissions are sent to CMS, it starts the 90-day clock for CMS's review and disposition. If a state would like to have CMS view the submission package prior to submitting, they may do so by allowing CMS to view the package in an informal manner. Alternatively, the state has the option of submitting a draft submission type to CMS. This is submitted to CMS for a more official review process off the 90-day clock. CMS may review, but cannot approve, disapprove, or send the package into RAI while submitted as a draft. CMS may return the submission package with feedback to the state following the review process. If the state chooses not to edit the return draft package, it may be closed and converted to an official submission that could be submitted on the 90-day clock for review and disposition by CMS. Any comments made by CMS in the correspondence log will remain with submission package after it's converted. Closed draft submissions cannot be edited, and official submissions that were converted from drafts cannot be edited with the exception of the SPA ID and proposed effective date prior to submission to CMS. If the state chooses to edit the draft submission prior to closing, the draft package must be resubmitted to CMS and re-returned to the state prior to closing and converting to an official package. Now we will move back into the MACPro system. We will log into MACPro as the CMS Submission Review Team. You are initially taken to your news page. This news page functions the same as for the CMS point of contact role. Notice that the instructions that the CMS point of contact wrote regarding the package are listed. If you hover your mouse over the small lock image in gray, you will see that only the CMS point of contact and you may see this post. If you would like to comment, you may do so here, and the CMS point of contact will receive a notification as well as see it in their newsfeed. You will have received an email notification letting you know that you have a task in your to-do list for this package, in addition to seeing the instructions on your newsfeed. In order to start on the task, go to the Task tab on the upper toolbar. Select the task labeled Review Submission Package ending in 741A. This directs you to the Review Submission Package page. Package information is listed, including the package ID, program name, version number, who submitted the package, the milestone date, submission type, state, region, package status, and submission date. Next, there is audit information, including who created and updated the package and when. The next section lists all reviewable units of the SPA. You will notice that the reviewable units are marked with an X in a red circle under Review Status. This indicates that the SRT has not yet begun his or her review of these reviewable units. If there was a blank circle in the Review Status column, this would indicate that you have not been assigned to this particular reviewable unit. The SRT can then click on the blue link to each reviewable unit one by one to review the data entered. Please note that an SRT may not make any updates to the data entered. It is a read-only copy of the submission package. We will begin our review by selecting the blue link to the Health Home Service Delivery Systems reviewable unit. Next, we will scroll down to the Review Tool section. We will expand the Implementation Guide Review Criteria section by selecting the plus-minus button. The SRT can compare the review criteria submission summary information to the implementation guide documents. The link to the implementation guide is located right below the package header and is labeled View Implementation Guide. As we open the implementation guide for the Health Home Service Delivery Systems unit, we see that the implementation guide provides explanations of the components of the page along with review criteria. Each reviewable unit has its own implementation guide for your reference. Content in MACPro should match the implementation guides. We encourage you to utilize the implementation guides to assist you in filling out your review within MACPro. Next, we will expand the Review Assessment section by selecting the plus-minus button. The SRT has the option to choose if the state's description and/or answers were sufficient, insufficient, unclear, or not applicable. If sufficient is selected, no further clarification is required. If insufficient or unclear is chosen, additional questions appear that are mandatory. MACPro is dynamic and your selections will impact what options you may select. For this demonstration, we will select unclear. An additional question appears asking if this issue is not resolved, what is the likelihood of the potential for disapproval? The SRT may choose from none, possible, or high to answer the question. We will select none for this demonstration. After selecting the radio button, the SRT may enter information about the potential for disapproval in the citation text box. We will enter NA. The The next question asks if more information is needed to determine if the review criteria have been met. We will select the radio button next to yes. A text box will appear to explain what additional information is required. We will type, "Additional delivery systems should be added." Next, the SRT will select yes to the question, "Is your review of this section complete?" Under the Analyst Notes section, the SRT will see notes entered by other users in this section if they exist. By clicking Add Note, the SRT will have the ability to create a note for this reviewable unit. Additional fields will pop up for details and note type. First, the SRT will choose a note type from the drop-down box. There are several types to choose from. The first is Note to Self. This is a private note for the individual's eyes only. Either a submission review team member or the CPOC may select this type of note. It is only viewable by the author and does not get displayed anywhere else or to anyone else. The next type of note is for POC formal review. This is a note to indicate information that the user recommends should be included in the formal summary of the recommended disposition. This note is made visible to the CPOC. The For the Review Team note is a note for other review team members. This is made public for the CMS point of contact and SRT members. The note for RAI is only available in an official submission type. It is used to recommend that something requires the package to be returned to the state. This note is made public to the CMS point of contact and SRT members. Next is the For Correspondence Log note type. This is a note to indicate information that the user recommends to be communicated to the state point of contact. The information in this note is made visible to the CPOC and SRT members. The non-SRT user note is included by a review team member on behalf of another CMS participant who is not a part of the official review team. For example, a subject matter expert or other CMS advisor. These notes are made available to the SRT members and the CMS point of contact. The next note type is a general note. This is a note to use when the information contained does not fall into the other note categories. This note is made public to all users. The justification note would be used to support a negative assessment of a reviewable unit. And the last note type is the post-recommendation note. This is used after the CPOC has had a recommendation. For this demonstration, we will choose For Review Team, which will be made public to other review team members and the CPOC. The SRT will type the details into the Details text box. We will type, "I believe that additional delivery systems should be added." The SRT has the ability to enter several notes. If the SRT wants to delete a note, he or she may do so by clicking the X marked in red. The SRT will then scroll to the bottom of the page and click Save Review Assessment. After your review is saved, you may navigate away from the task and your review will be saved. Your review of all units do not need to happen in one session. We will scroll to the bottom of the page again and select Return to Package Summary. You will notice that the reviewable unit that the SRT just reviewed appears in the completed status, indicated by the green checkmark in the My Review Status column. The SRT will then click on each blue reviewable unit link under the Submission form and the Health Home SPA section and complete the review tool. For the sake of time, we have completed a Health Home SPA submission package that has all reviewable units completed by the SRT member. We will utilize this fully reviewed submission package in the following steps. After completing the review tool for each applicable reviewable unit, the SRT will select the green button labeled Complete Review. Please note that you do not get a message asking if you are sure you wish to complete the review. Additionally, the SRT does not have the option to go back and edit the review tool once complete review is selected, due to the fact that the submission package has moved on in the workflow. Please make sure you want to submit your review before you select complete review. After complete review is selected, the SRT can go back and look through the Analyst notes. You can access the Analyst notes by selecting Records on the upper toolbar, and then selecting Submission Packages, View All Submission Packages. Next, we will select the package ID ending in 741A. On the left-hand toolbar, we'll select Analyst Notes. And here we will see the note that was just entered during our review. Now, let's return to the PowerPoint to review what we have done thus far as the submission review team member and what the next steps are. This slide includes the information that we just reviewed in the system. This is for your future reference. We also discussed the different types of Analyst notes that can be entered by a CMS point of contact or submission review team member. On this slide, each note type is described, and it is noted which users can view the specific type of note.